Welcome to the Performance Driven Academy. We are at our 10th webinar today. We are talking about strategic planning. The PDA series is brought to you by the Managed Care Technical Assistance Center, a partnership between McSilver Institute for Poverty Policy and Research and Center on Addiction. I am Brandon O'Connor. I'm the Associate Director of CCSI Center for Collaboration in Community Health, and CCSI is the upstate partner of the MCTAC group. Just a couple of reminders. You should have received the webinar PowerPoint in your inbox a moment or two ago, and if you don't, it will also, we'll be sharing the link of the live slides over with you in the chat box, so just give us a moment to get that together. There is not going to be a survey in the chat box this time about our last webinar, since our last event was an in-person event. If you do have any questions or comments at any time, feel free to chat them in to all panelists, and we will see if we have time to answer them at the end. As usual, if you have any concerns or questions or have any issues, please feel free to contact us at pda@ccsi.org. Today's webinar is really focusing on the planning component of the planning process as part of our performance-driven organization elements. So really thinking about what does strategic planning look like and how does it really help in pulling the pieces together that we've already spoken about. Our roadmap of where we are nearly finished with our Performance-Driven Academy, so we have a few more webinars today, and then next time we'll be talking about monitoring population characteristics. Our last webinar will be around marketing and communications. How do you message all of the good work that you've put into the year and figuring out your impact and how to measure it and how to balance that with your finances. We will have one more in-person session, similar to how we've done it throughout the year across a couple different locations. We'll be aiming for early December for those, so hopefully we'll beat the weather. And that will be where we'll really pull things together from this last set of webinars, and then we'll be done, and so we'll inevitably send you another evaluation. We'll be sure to send out certificates of completion and then ask you kind of what else MCTAC can provide for you moving forward. With that, I would like to turn the webinar over to John Lee, who's going to be talking to you about strategic planning best practices. John?
Good afternoon, everybody. Thanks for participating in this webinar about strategic planning, and it really is strategic planning for a performance-driven organization, so that as we move forward, we really will be thinking about how to move forward with a strategic planning process that really gives you what you need to prioritize and do the right thing for your organization based on data. Here's a little bit of background about me. I have been in the health and human services world for quite some time. I actually worked at a hospital for a number of years, did basic hospital management as well as new business development. I've worked for a couple of managed care organizations. And, you know, I did go to school to get a degree that allowed me to do this kind of work. So the learning objectives for today's webinar is really to give you a sense of why an agency might decide to move forward with a strategic planning process. What are the steps that you might consider taking to be successful? What are the pitfalls of not doing it right? And again, because we're so intensely focused on data, what are some of the planning data needs, and what ought you consider collecting so that you can do the right kind of work? Probably most folks have heard the word strategic planning, and hopefully, you know, the experience you've had around strategic planning process has been positive. The key reason for developing a strategic plan is really to take some time to step back, think about what you've done historically, where the environment is moving to, and to help, based upon a reflection of all that information, prioritize the work that you need to do and make sure that your resources are in alignment with the things that you believe are really going to be most important to you. Why would an agency want to complete a strategic planning process? Again, for very much what we just talked about. It is a way of, when done well, a way of getting alignment from leadership of an organization, and that can include leadership of the agency plus board leadership, in determining what is it that you want to do in the near future to really make sure you're doing your best work based upon your mission and your vision, and that everybody is in agreement with the prioritization, which would result in clearly identifying where your, in many cases, limited resources need to be invested to move forward. So, basics in terms of why you might want to consider moving forward with a strategic plan is it does set a direction and a set of priorities for the agencies. Basically, you can consider it a roadmap. Oftentimes, I think of the end result of a strategic planning process as a strategic framework, because it does set the direction, and it is something that you ought to be paying attention to, not just as you complete the strategic planning process, but once every 6 months, so that you make sure that you continue to move forward with that framework, or if you believe the framework needs to be updated, you can make that decision. Critical to success is that it gets everyone on the same page. It should simplify decision-making. Again, limited amount of money to invest in the future. Where are those dollars going to go? Well, as a result of your strategic planning process, you should have figured that out. It does support an alignment, and it really is critical in terms of having a message that will go out to all of the staff within the agency, as well as funders and other stakeholders. So we want to take a little bit of time to talk through how you might approach a strategic planning process within the framework of a performance-driven organization. And as we think about this, I just want to call to your attention some of the considerations that we've given in designing this process that has been used multiple times in the past to address some of the pitfalls that others have identified in the past. One is, in advance of holding a strategic planning meeting, you take some time to collect the data that you need so that you can really see what you've accomplished in the past, as well as taking some time to complete an environmental assessment so that you get a better sense of what the future holds. You do that before you get the team together. You really, in having a strategic planning meeting, you're mindful of who your key decision makers are, and you include them. And you really respect the fact that time is limited and try to get as much work done when you bring folks together. And that is the work that really requires, the conversation among the members, as well as paying attention to ways you might be able to collect data from them or others using surveys such that it isn't a massive amount of time required in order to get perspectives from others. So those are some of the things that we've taken into consideration, as well as making sure that the document is not something that just sits on the shelf. We really make sure we fold into the process a clear sense of what happens next and assigning accountability for priority initiatives. So the second step in the process is, as we talked about, providing an overview of the changes that are taking place in the healthcare system with a focus on those that are really going to be of greatest significance to you and your agency. And we found that the best way of delivering this kind of overview to those that are going to participate in the strategic planning process is through an in-person session that gives folks the opportunity to ask questions. And we really do believe that the value of this is going to be greater if we're mindful in terms of the language used during the presentation. You don't want to assume that everyone is a clinician, but that everyone is really interested in the agency, and then you actually create your presentation in a way that reflects that kind of enthusiasm and make sure people have the opportunity to learn from that presentation based upon using the correct language. The third step is, in the way we approach, once your planning team has been identified, is to ask them to respond, in our case, through an electronic survey to obtain feedback. And that feedback can be on the strengths, their perceived strengths of the organization, their weaknesses, their opportunities and threats, as well as perspectives on what the organizational priorities ought to be over the next 3 years. In these days, some may say, 3 years is a long time, and I agree. Oftentimes we're really looking at a 1 to 2 year window with the idea that a strategic plan may need to be updated. But for the course of getting feedback from your planning team members, again, members of your leadership team, as well as board members, it's good to think about that 3 year window. When we're collecting feedback about organizational priorities, it can include things like a perspective on your facility, on the program development or opportunities for program expansion, infrastructure development such as IT, compliance, revenue cycle management, thinking about opportunities or success in strategic relationship building, as well as a sense of what the agency culture is, and is that the culture that you want it to be. Again, the reason that doing this kind of survey becomes important is it allows all of your participants to offer their perspective, and then for you in advance of the meeting to summarize that and give it back to the planning team so they can see the collective perspective on those that are at the table. So that's the perspective of the planning team, and you can actually take that tool and have it shared with all the members of the board if you would like, and you incorporate their feedback into the summary of your feedback. You don't necessarily need to have it just done by the planning team members. And in fact, I do know one agency that decided to send a part of that survey gizmo to all of their staff members so that they could get a staff perspective on key issues within the agency. And why do that? Well, the staff are there. They really have a personal perspective on what the experience has been within the agency and what the opportunities are. And it also supports their buy-in as the process proceeds. So step 4 is really to collect the following data or information. And you'll see information about referral sources, who you have strategic relationships with, who are your key payers, and you got to include the managed care companies, as well as government, other funds through grant-making agencies. Population characteristics become really important here. Again, think about a performance-driven organization. We really need to know the impact of our services, but very importantly as well, we need to know the impact of our services on the populations that may have unique characteristics. So it's worthwhile to look at your population by age, gender, race, social identities, and really begin to understand who you're surveying, because that will then allow you to pay attention to some of the evidence-based practices that may particularly be successful with the population that you're supporting. It also allows you to begin the process of linking your outcomes against your population characteristics to look for some disparities in outcomes that you might want to address as a result of that process. We think it's important to really map your agency program and service interdependencies. Who relates to which particular agency services relate to others, and how do they really tie together to make sure that there's synergy in terms of the outcomes that are provided. And performance indicators include fiscal, quality assurance, service volumes, compliance, customer feedback, staff feedback. All of those areas are really important for a planning team to pay attention to. And I would say that, it isn't just about having data that says, here is the population that we're serving today, or here's our performance upon a particularly important metric that perhaps you can find in Psyches or in CDS, the OASIS data set. It's really developing the database in a way that allows you to look at change over time, and for that to be easily understood by folks that are a part of the planning team. So think about graphing it. Think about charts. Think about pie charts. Think about the way the data has been presented to you through the various webinars and in-person sessions the Performance Driven Academy has already offered, and make sure that you're using those best practices as you're providing information to your planning team. It can go a long way in making sure you're getting the best possible results. One other opportunity for you to consider is whether detailed operational assessments of key areas of the agency's infrastructure ought to be completed. We found that this is important. It's really a focused assessment of a particular area, such as IT, contract, or corporate compliance, contract management, and done by somebody that has sufficient experience in that area to be able to clearly identify and then articulate the gaps that have been identified. And and recall that you may have had a particularly good, appropriate billing system in place that was installed 4 or 5 years ago. Is it still meeting your needs? That's the question that you need to have someone help answer. Meeting your needs in a world where there is more managed care contracting, where there are movements towards value-based payment contracts. So as you look at the infrastructure that you have and what gaps may be in existence, you need to pay attention to the evolving world of heightened accountability and of expectations and of both more payers as well as some additional competition. So everything that you do, you need to frame within this world where having more data and information can help you strategically determine where your areas of focus ought to be and where your investments ought to take place. So we've got the planning team. We've collected information from members of the planning team, or more broadly if you prefer to do that. And we have some data that's been nicely graphed so people can see change over time. So the next thing from our perspective is you really bring that team together and you do a strategic planning session. And it can last anywhere from 4 to 6 hours. And I know that sounds like a long time, but we've actually found that it makes a whole lot more sense to bring your planning team together for an extended period of time as opposed to thinking about having a series of planning sessions, 1 to 2 hours over the course of 3 months. Why do we do that? Well, there's learning that's taking place in these sessions, and if you begin a practice of bringing a team together and they've learned a certain amount of information in the first meeting and then you wait another month to have a follow-up meeting, well, practically speaking, some of what they've learned and some of their energy around what they've learned could be diminished as you move from the first to the second meeting, and then it is a matter of taking some time to bring people up to speed and reminding them about what they learned at that first meeting. So if you can get folks to commit to this meeting and you're providing with the appropriate kind of information in advance, the data, the reflections on their experiences, you can really accomplish quite a bit within this extended meeting time, which really is a better use of everybody's time, including members of the leadership team as well as board members. So what might an agenda look like? And here we have 4 different categories of agenda topics. And don't forget, give them a break, feed them lunch, respect the folks that you have at the table, and think about the best location. Sometimes this can be done right on site with the leader, with space that's available to the agency, but sometimes it can also make sense to pull everybody out of the agency for a particular day. Have the right space, have the right kind of support in terms of snacks and lunch, and free people up from thinking about what is going on around them by taking them to a new location. And there can be places that you can find that you might be able to get at no cost. And I think sometimes that's important. But the 4 categories of agenda topics that we typically see would be, number 1, setting the stage, having a conversation about how the agency's success will be defined, identifying the work to be done to achieve that desired success, and then prioritizing the work. So we're going to spend some time digging into each of those topic areas. So setting the stage, here are the things that we find are helpful to cover during this period of time, and we don't want to have an inordinate amount of time spent on setting the stage. And it can be done as an overview if you've shared this information with the members of the planning team in advance and ask them to take some time to review it, the things we talk about. An overview or reminder of the key environmental changes impacting the agency, including the identified service gaps that exist in your community. Review of available agency performance metrics. If you have a dashboard, this is the perfect time to get it updated and share it. But oftentimes folks may not have this dashboard of key metrics that include fiscal performance, quality, service volumes, corporate compliance, customer feedback. If not, it's perfectly fine to pull that information and have it available, again, in advance for review. But then here's the chance for you to summarize what you see in this information, whoever's leading this meeting, whoever's asked to do it. What do you see in terms of fiscal performance? Go beyond just presenting the data. What meaning do you attribute to that information? Again, that's why it can be so important to actually see changes in some of these indicators over time. Are we improving in terms of key quality areas? Are we seeing a dip, and if so, why? And this also gives you an opportunity to see what kind of gaps in measurement might currently exist, which will inform your conversations moving forward. We would say, if you don't already have a dashboard, then one of the things you might want to focus on as a priority area is to develop that dashboard. That's just an example. What are the key referral sources for agency services? Who are the key payers, and what percentage of the money that you're taking in comes from each of those payers? Because you do want to be able to pay attention to them. They are payers, but they're also customers, a different category of customer, and we need to look at it that way. Overview of service interdependencies. Where are we seeing these linkages, and are we really reinforcing those linkages in the way we do our work today? Thinking about a mini system of care within our agency. If you're not, that may be something to pay attention to. Let's talk about the planning team and board survey feedback. When we asked about strengths, weaknesses, opportunities, and threats, which themes bubble to the surface, and how are we going to make sure we're addressing those considerations as we move forward? And review the key findings and recommendations from the operational assessments. Time was focused on looking at these areas that you really want to assess to see how you're doing. What does that mean in terms of our future planning? Okay, agenda item B is deciding how the agency's success will be defined. And, you know, within CCSI, we've built some processes to move forward on this, but in summary, you know, you're going to need to look at your mission, your vision, your values, and your value proposition. And if you don't have any of those, then make sure that that's noted, because moving forward, it's going to be so important that you're clear on where it is you want to go, what your values are in moving forward, and what is your value proposition. You've got to have heard the use of the phrase value proposition before, but it's so important in this process to really understand what it is that you do, what is the impact of what you do, and how is what you do different from others. Use the feedback from the planning survey questions to assess the agency's value proposition to assure its relevance. So even if you have it, let's take a look and see to make sure that it's still where you want it to be. And you can draft additional value propositions options based upon pulling all this information together. If when you look at your current value proposition, you're saying it really isn't what you want, you don't think it's where it needs to be given where you want the agency to go. Then in terms of another agenda item within this category is identifying the work to be done to achieve desired success. So we've looked at our data, we figured out what our value proposition is, and now we're going to be talking about what is the work that needs to be done in order to move us in that direction, right? So based upon the information that we reviewed, we brainstorm a list of actions that the agency ought to be taking to prepare for the future and achieve agreed upon value proposition by the category of potential need. We review the list, we combine common actions where appropriate to seek appropriate to understand the meaning of each by the entire group, and then we begin to group the actions that are a part of an impact category of strategy priorities, such as maintaining fiscal viability. And the last category is really prioritizing the work. This is rank order the various actions that were identified by impact category and determine which actions and initiatives need to be addressed in the upcoming 12 months. So going through the process, we've looked at our data, we've gotten feedback from our leadership and board, we've synthesized that information, we've updated our value proposition, we've figured out what is really going to be most important. Then we look at, based upon our decision to move forward in that direction, what do we believe to be the most important areas of focus for us, priorities, projects, initiatives, whatever you want to call them, and then you spend some time identifying what are the things that are going to be most important to us over the next 12 months. What's so important is, as a result of your process, you may have 20 different projects that you would like to pursue, but most agencies aren't going to be in a good place to pursue that number of projects all at once. So it really makes sense to pick 6 and then think through what your process is going to be like for moving forward with those 6 initiatives. Because, again, we want the planning process, the framework that's been developed, to not just give you a document that you put on the shelf, but to help you move forward with making the change that your agency needs to make. So that would be the agenda items for your strategic planning meeting. And then what's the next step? It's really develop that draft report which summarizes the conversations that took place during your strategic planning session. For us, a narrative is important because it does connect the dots and talks about the conversations where a particular agency decided they needed to spend a little more time on. But we also think, as I said before, I often talk about it as a strategic framework. I actually think it's important and ultimately helpful to actually have a graphic that describes the efforts that your agency wants to take in order to achieve a desired outcome. So this is an example of a graphic for a made-up agency, but this is structured in a way so that you do have a long-term outcome that's off to the right. This is really, in this particular case, through the delivery of community-based recovery support and wellness services, we're going to reduce the reliance on inpatient and ER services. So that's the outcome that was determined by this agency. Then you see, moving to the left, these are the goals that were identified by this agency. Categories and goals, they're going to take a little bit of time to achieve. They're not necessarily 1- or 2-year initiatives, but you can see one of their goals is to build a healthy fiscal environment, including growth and diversification of funding sources. So if they want to do that, what are the initiatives that are going to drive the attainment? And you can see that, again, continuing to the left, there's a series of very specific projects or initiatives that have been identified. For example, if we're talking about including developing a healthy fiscal environment, we want to make sure we're securing back office, the right kind of back office infrastructure to make sure that we're managing our funds, that we have a good understanding of what our costs are, and that we're promoting timely billing. Then you actually have the conversation. In this particular case, it's kind of a summary of a conversation. What are the resources that are going to be required to move forward with these initiatives? And then, again, this summarizes that, technology may be a part of the solution. Staffing may be a part of the solution. Hope can be a part of the solution, which, again, is really a part of the culture of the organization. But this is important for us because it allows us to see everything that we've talked about and what we really want to achieve and why we want to achieve it on one page. It's also a good tool for communicating to staff and others that weren't a part of your strategic planning process. this is what we came up with, and this is really where we're going to focus our energies. And if there's too many initiatives on the list that you believe you can hit within the, the next year to 15 months, one approach to take is to highlight those that are going to be most important to you. These are all important, but the most important, the 6 most important initiatives you could color in a particular bright color, and you could say, and here's where we're focusing first. Then once we've accomplished those, we'll move on to some of the other things that are on our list. And then step 8 is, as we've talked, it's the development of a process for implementation of the priority projects. So we've taken the time to say out of the 20 initiatives that were identified, we selected 6, and again, you can use survey gizmo to survey the folks that participated in the planning process, which are the most important. We actually do it, we ask questions of those that are helping to rank order the projects. We ask them, how important is this, using a like scale of very, very important to not very important, and then how feasible is it to accomplish? And again, something can be really important, but really not very feasible for you, either because it's just plain too costly or the environment doesn't allow you to move forward. So you combine the feedback on those 2 perspectives, importance and feasibility, and then that helps you identify what are the most important projects for you to move forward on. So again, taking this out of away from being a document on the shelf, we identify 6 priority projects as an example, and for each of those projects, we do something very specific. We identify who will lead each project. We develop a work plan for each priority project, and the work plan should really assess how the project should be informed by the elements of a performance-driven organization, and that includes and when we think about a performance-driven culture, how does that impact this particular work? Is it informing it? Is it something that we need to reinforce? We want to make sure that as we think about moving forward, we're thinking about how this reinforces and can support internal and external collaboration, very important themes in terms of moving forward. And then the key processes, monitoring population characteristics, effective measurement practices, continuous quality improvement, practice development and management, revenue cycle management, corporate compliance, contracting negotiations, human resource practices, and marketing. As you're rolling out your work plan, think about what does this mean to those particular processes. Is it an initiative that's going to reinforce and strengthen those processes? If you haven't thought about the impact of this particular initiative on those areas of your organization, it's really important to do it because it's going to inform the work plan and make sure that you're moving forward in a way that really supports the notion of being performance-driven. And what we also believe is important to do for each of those priority projects is to really take some time to think about what the resources will be. And number one, what are the resources that are required to actually work on finalizing the work plan? Who needs to be involved and how much time is it going to take? But what kind of investment will be required from the agency? And let's make sure that we've figured out at least a sense of what that is before we move too far along, because you want this to be doable. So if it is a project that you just don't believe you can really fund, then you might want to just start by taking a part of that and moving forward, phasing or staging that particular initiative in a way that allows you to limit your investment in a way that is reflective of your agency's capacity at the time. And it's also so important that you develop a process for monitoring the progress of those priority projects. So you've developed work plans, you've got someone responsible, you know what the resource requirements are going to be. Okay, how are you going to monitor the implementation of those work plans? Who will that particular person been held accountable for moving forward reports to? Is it the leadership team? Do you create an agenda within, an agenda item within your regular occurring leadership teams to cover that? Do you have a special oversight body that may include a couple members of the leadership team and some board members who are invited on a monthly or quarterly basis to get updates? But the accountability for moving forward will be enhanced if, in fact, there is some reporting out. And I think that can, at times, differentiate the successful implementation of a strategic plan versus not. So, last couple of slides are really just to give you a little bit of perspective about how you might define success in a strategic planning process. Some of these are, I'm sure, are things that, yeah, are common sense, and some, you may want to give some thought to. One is the real importance of achieving consensus among the members of the leadership team and board around what are the priorities of the organization. We think the process that we've outlined by focusing on data, by acknowledging perspectives about what's working well and where the opportunities are, should move you towards consensus. But it is so important periodically to say, are we all on the same page? And if there needs to be some tweaking done, some more time and energy focused on getting people on the same page, then that alerts you to that need. There does need to be effective communication of the plan throughout the organization. That's one of the reasons why we propose the development of a strategic framework or that graphic document. It doesn't have to look like that, which today happens to look like a logic model. We've done them in a lot of different ways, but the idea is to put as much, not as much as you can, but put the key elements on a one-page graphic, add some color, add something that's interesting, and take the time to review that with staff and with the board. But even before that, it's important to let folks within your agency know that you're moving forward with a strategic planning process, and here are the people who are going to be involved, and here's why we're doing it, and really get them excited about this work, and tell them that it's going to be an efficient process, and that we're really focused on using technology to share information, using time together to make decisions. The priorities and the reasons for the focus of these priorities are understandable to the staff. Again, that's a good test. Why are we moving in these directions? That's the question that staff are going to ask, and it's important for you to be able to answer that because it also creates credibility for you as the person that may be leading the process or participating in the process. I've mentioned this as well, but to be successful, you got to have some resources to be allocated to the implementation of the priority initiative. You may not have everything that it takes, but do you have something to allow the process to move forward? Can you invest in somebody's time? Give somebody more time to focus on a particular initiative and really clearly carve that out in their day or in their week. And if they just don't have that time, but you want this person to do the work, then maybe you need to reassign some of their work to someone else. But really think about that. Making it additive sometimes can work, but oftentimes folks are just too busy to be able to do this and do it well. You also need to make sure there's a well-structured process to manage the implementation of the priorities. We talked about that. That measures really have been identified to track your success and impact of the strategic planning process. So how are we going to know we're successful? Well, part of that is going to be driven by moving forward the implementation of the work plans. But let's spend a little time to talk about, for the priorities that we've identified, how are we going to determine success? And what do we measure to know that we're moving in that direction? To be successful, we believe that there needs to be a process in place to collect the data, analyze it, and report out on the impact. It's really so important. So what are some of the pitfalls tied to planning? And you may have your own stories about this, and if you want to put them in the chat box, we'd be glad to share them if time allows at the end. I would say one of the key pitfalls tied to planning is not being data-driven. And that really is a theme of the work that you've been participating in over the course of the last year. Being performance-driven means you have data, that you're using that information to inform the direction that you want to take. Not having data to know your position in the marketplace. That's one very specific area, including the characteristics of the population you're serving and whether the services the way those services are being provided are in alignment with the characteristics of your population. Not having done some research to understand leading-edge practices in your field. Service delivery is evolving quickly. We need to always be paying attention to what is out there that will help us do our job better. That will inform your planning process. Not clearly understanding who your customers are and what are their expectations. Customers, competition, two key words that we aren't always used to seeing, but we're seeing more of. So your customers is a managed care company. Ask them, what do they want? What are the things that are important to them? What kind of communication will be helpful? What kind of reports need to be delivered? You need to make sure those get factored into the investments that you're making. And also not knowing the actual costs associated with delivering your services. That can be a problem. You've heard a lot from Dave Wozniak over the last few months about revenue cycle management and appropriate billing practices, but also the importance of cost accounting, being able to know what your costs are. You're going to be making decisions about the development of the new services. It's so important that you have a perspective on what those costs are. Another pitfall is just plain taking too long to cycle through the process, and it results in a lack of enthusiasm. That's why we're presenting this process where there's a lot of front-end work, and you really take the time that your planning team is investing in the process to get their collective wisdom, to get their agreement, and to get them energized about the direction that's being set. Not having full participation of key agency leaders. Yeah, so important. You've got to make sure that it is important to all of the members of the leadership team and that we figure out how to carve out the time so they can fully participate. Also, not allowing the participants to feel comfortable in thinking out of the box. So it's, not encouraging creative brainstorming. That's really a part of the strategic planning process. Yes, there's a lot of data to be reviewed, but also there's a creative element in seeing how all this information comes together to formulate a direction for you and to problem solve and overcoming some of the barriers that are perceived in getting there. That's why, encouraging people to think outside of the box. You don't have to accept all the ideas that come forward, but you want to respect that creativity. Put them up on a piece of paper during the meeting if something comes up that seems to be particularly creative, and then take some time to debrief and get everybody's perspective. But respect that brainstorming. Don't allow the plan to sit on the shelf. Okay, we've heard that an awful lot of times. Now, folks, there's no point in strategic planning. We're just going to have a document that's going to sit on the shelf. No, this is why it needs to become a dynamic document. This is why you need to think about and carve out the appropriate number of projects for you to move forward based upon that plan, appropriate for you and the resources that you have. But keep moving, keep moving. And also, a pitfall can be as a result of not seeing the synergistic impact of tying the agency culture, practices, processes, and infrastructure together as a part of the planning process. Yes, in doing this work, thinking about the culture that's going to allow you to be performance-driven and do the important work for your staff, that's so important. Thinking about the practices and processes that will support that, and what infrastructure needs to be brought to the table to make sure you can efficiently deliver the practices and processes within the culture that you're looking for. All of that needs to be a part of a successful planning process. So, question about who should be involved. Oftentimes people ask this question. I kind of gave you opinion before. I'll just reinforce that. Just in terms of numbers, I usually think about a strategic planning team and a team that's going to participate in this 4 to 6 hour session of being no more than 12 people. If it can be 10, that's good. 12 is okay. But if you're too large, you can really hinder the group in moving forward at a meaningful pace. you can find ways of getting feedback from others. So even though the core team may be 12 people, you can solicit feedback from other board members, from other staff members, using a tool like a survey gizmo and incorporating that into your planning process. Don't forget to involve your clients. You may have a client satisfaction tool that's already being used. Consider giving perspective to that as a part of your planning process. One of the cautions I would give in looking at the client satisfaction survey is if all of those questions that you have included on your survey result in high marks for you, satisfaction and high levels of satisfaction, then think about whether you're really asking the right questions or, in fact, the hard questions. The reason you ask your clients is so you can get meaningful feedback. If they say, everything is great, you're doing great work, then it's not telling you what you really need to know. That's nice to know in general, but you really want to think about other questions and maybe getting a little bit more specific around, okay, is the wait time too long in your waiting room? Do the people ask, is your staff friendly? But you can think of things that are really meaningful and maybe even relating to the impact of those services. Are they getting what they expected to get out of the service? There's a difference between satisfaction and impact, and you need to be paying attention to that. Also, to take a draft list of priorities on the road to obtain feedback from staff and or strategic partners. Depending on how you manage it, you may say, okay, yes, this set of priorities is just the beginning. You know, we want to make sure that everyone is buying in, so we give folks the opportunity to give their feedback on those areas. But if you're going to ask for feedback, it's so important to explain to them how you came up with those numbers or those recommendations, because if you are if you've devoted all that time to a good process, it should be easy for you to explain, and it should be relatively easy for the staff to understand why you prioritized as you did. So another question that oftentimes gets asked is, do you really need outside support to have a successful strategic planning process? And my answer is, not necessarily do you need somebody from the outside. And the questions you might want to consider as you are deciding whether to get someone from the outside would be, is there a person within your organization with solid facilitation skills? This doesn't require that the individual know everything there is to know about all the services that you're providing, but they need to know how to engage a team and make sure everybody is feeling comfortable in participating, knowing when to move a conversation along if you're stuck on a particular area, and to manage against the agenda. So if you got somebody that can do that, hey, good for you. Is there a person that would be respected as a facilitator by those on the planning team? Important. Just general respect. Is there a person that does not have preconceived ideas about what the organization ought to be doing in the future and does not require that these ideas be expressed to others? So think about this. You know, there's no reason why a CEO couldn't facilitate a strategic planning process, but when they're facilitating that process, they don't want to be the CEO. They have to be someone that's sitting there really encouraging others to participate. Doesn't mean that they can't say, hey, I think this is important, but that's got to be a minor part of their communication. And it doesn't even need to be a CEO, anybody. You know, they have to know that when they're facilitating this process, that they need to be as much as possible a neutral third party interested in getting everybody's ideas on the table. Also, is there a person that has the time to synthesize all the information into a strategic planning document? But critical, and that's really, really important too, having the time to develop the agendas, to facilitate the meetings, to create the documents and all that. Key really is whether you've got a person that can really do all of that has it all. They have the right kind of skills and facilitation, the right amount of time, the right kind of respect. Ideally, if you can say there's somebody in your organization that can do that, and again, it doesn't need to be a member of the leadership team. You may find that there's a board member that's got this kind of skills and is willing to do that. You know, feel free to ask them to participate. But if you don't have somebody that you feel really will be able to facilitate in an objective way, has the patience with the process, can move organizations along through the agenda, can help, strategize and problem solve as necessary, then you might want to consider bringing somebody in from the outside to help you with that process. And you can limit that involvement, but you're making an investment of your leadership team time, hopefully some board members' time, and so you want to make sure there is a payoff to that. And sometimes bringing somebody in to help with the process can increase the probability of the right kind of payoff, that the work is done, that you wanted to have done once the process is over. As we've done in the past, we offer tools to support your work, and this will be converted very shortly, hopefully by the time you get your copy of the PowerPoint. But for this particular category of work, we thought that it might be helpful as an exercise for you to look at a list of data elements and just answer. If you were asked to pull together information for a strategic planning process, would you be able to do that on a timely basis, or would you be scratching your head? So this isn't meant to be an all-inclusive list, but it's to begin to get you thinking about, number one, the importance of data, number two, the timeliness of securing the data, and I guess number three is how you present the information so that it has meaning and can be analyzed. And so oftentimes, again, that's changed over time. But what we've got on the list, including things that different department heads ought to be able to provide: key referral sources by programs, strategic relationships, who are the key payers, what part of your agency revenue is coming from those payers, population characteristics, so important. If you really want to fully understand the impact of your work, who is it that we're serving? Can you cross-tabulate that against the impact of your work? That can give you some very, very meaningful information. Customer, payer, partner feedback. Are you getting it from everybody so that when you're sitting down together, you have a sense of perspective? What do others think about your work, including your customers, which could be your managed care companies, or could be the clients that you serve, could be your staff. Also, performance indicators that give a sense of how you're doing fiscally, quality assurance, service volume. Certainly change over time. We like to see at least done by on a quarterly basis with a year-to-date figure. What are the compliance audit results? What feedback are you getting from the folks that you provide support to, services to? And what does your staff say about the environment that they're in, their perception of the services that you provide? So, what do I do next? So the takeaways in terms of how you might be able to get started. Number one, use that tool. You can just take the slide, or again, we'll have it in a Word document for you very shortly, or PDF. Use the tool just to go through and see if I was asked to pull that data, could I? What are my limitations? I think this whole idea of assessing your limitations of data and opportunities to expand your data collection has really been a theme throughout most of what we've done. It gets reinforced and becomes so important when you're doing your strategic planning. Also, here's a suggestion. Look around your agency to see if you can find a current strategic plan. Something that says, okay, over the next couple of years, here's the direction that we want to take. If you haven't done it, and if you don't feel like there's a clear sense of direction, then you might want to consider, moving forward with a strategic planning process. But I would look at that and really understand whether, your agency is at the point culturally and operationally where walking through this kind of process would really be of value. It is, we think that it is of value to most agencies, but it does take a hard look. You need to be ready to do this kind of work, and you need to be able to say, when we're done with this process and we've identified collective wisdom for priority setting, that we can move forward with it. So that's some consideration. As always, I'm going to turn it back to Dr. O'Connor, but I would also say if you have questions about anything that I've talked about during the webinar, just in the event my email address isn't there, it's jlee@ccsi.org, and you can always refer the question through the PDA email address that you saw at the very beginning of the webinar. So again, thanks for your participation, and here is Dr. O'Connor.
Thank you, John. Thank you for a very informative webinar. This is the time that we usually set aside for questions. We are out of time today. There haven't been too many that have come in, but we will make sure to get out responses to any that are pertaining to the content as soon as possible on the PDA@ccsi.org email address. You're looking at the next dates for the webinars and the in-person events. The registration links for the webinars should have come out, and we'll certainly send reminders, so please make sure to register for those so you can watch those, and just keep an eye out for the in-person event registration links as well. And with that, we are finished for the day. We thank you very much for your time and look forward to speaking with you on the next webinar. Thanks, and have a great day.